So there are basically two types of thyroid diseases, hypothyroidism and hyperthyroidism. So when someone has hypothyroidism, their thyroid gland is producing less amount of thyroxine. So based on the TSH, that is thyroid-stimulating hormone level, one needs to get their the thyroxine levels adjusted. So we supplement thyroxine level based on TSH reports at doses of 25, 37.5 or 50 micrograms or even 100 or more micrograms. So the level of supplementation predominantly depends on the thyroid stimulating hormone response to the body. Now there is a counterpart to it, that is hyperthyroidism. So in hyperthyroidism, naturally body produces more thyroxine. So it is important that you reduce the amount of thyroxine in the body secreted from the gland. So there are options like PTU, that is propyl thiouracil, 100 milligrams, or neomercazole. The drug name is carbimazole. It can be given as 5 mg, 10 mg, 20 mg, twice or thrice a day, depending on the TSH level. So when you are trying to bring down the thyroxine levels in the body, you are actually helping the metabolism stay normal. So either being hyper or hypothyroidism, we need to make sure the thyroxine level is constant throughout the level in the body. So when there is an entity called Graves' hyperthyroidism, in which if the thyroxine, the thyroid gland, the hyperthyroidism is not well controlled, you will have side effects that may occur, that may affect most parts of the body, including eyes, protruding eyes, and then lid lag syndrome, and then people will have higher heart rate, higher blood pressure, and insomnia, and all these things. So with these things, when they are manifesting, we need to make sure the thyroid gland under secretes thyroxine, which is why we go for medicines in the initial stage, and then we go for subtotal thyroidectomy. That is, we remove most part of the thyroid gland. We make sure there is some amount of thyroid gland that remains, which produces enough thyroxine for the rest of the body. And in case post subtotal thyroidectomy surgery, if the amount of thyroxine secreted by the body is not sufficient, we'll probably have to supplement some amount of thyroid extra, which is much safer compared to having a hyperthyroid state.